Welcome, friends. Revise with me homeopathic remedy Medorrhinum. Here we are dealing with Part 2A PQR review in classical format, and the text is taken up from Allen's keynote. And this is the second step in the study of Allen's keynote, which is going to make it much more systematic from materia medica point of view and applied point of view. This is a very good transition study for BHMS students, interns, house physicians, and the people who have academic interest and they would like to see the different dimensions of homeopathic materia medica. I am Dr. V.K. Chauhan, homeopathic physician. So let us first analyze why and what is the classical format we talk about. So some of the information comes from the aphorism 5 of Organon that the master tells us while taking up a case what are essential features which needs to be taken into consideration to achieve a cure. And he tells us we should know about the exciting cause if we are dealing with acute disease. And fundamental cause is a very very important if you have the insight. If you are dealing into the chronic disease, the approach is different, and for that reason you should know at least the constitution of the patient. Constitution means its somatic profile or physical attributes and his mental characteristics, intellectual characteristics, his occupation, mood of living, habits. His habits are the personal lifestyle and social indulgence and social lifestyle is very, very different. Domestic relation, age, sexual functions are important. Now, if you further go ahead for case taking, then comes the Bonninghausen, who gives us the 7 points which are essential to complete the totality, where quiz is who is the client. Client is a individual, he has a personality, soma and psyche. Then quid is what? Disease, what is the peculiar nature of disease we have? Then ubi, where it is seat of disease, whether it is a flare of sora or it is a chronic miasm. And then quis auxilis or concomitant symptoms are very very important, followed by why, kar, cause of disease, exciting cause, maintaining cause, fundamental cause or miasmatic cause. Comado tells us about the modalities in terms of aggravation and amelioration, like food, drinks, weather, position, heat and cold. And lastly, he tells us about the time modalities are also important. So everything is a kind of format. If you can make a format, so that is a classical format which includes the guidelines given in aphorism 5 and also the Bonninghausen 7 points to complete the totality of disease picture. It includes the number one heading is constitution. So here in constitution we have soma and we have psyche, and then we go for causation. So in causation we have diathesis, and in diathesis we have the miasm, and exciting causes for acute disease. Then we go for characteristic symptoms, and in characteristic symptoms it can be physical characteristic or mental characteristic general, characteristic particular general, characteristic concomitant symptoms. And then in relationship we see remedies which are similar, which are antidotal, which are follows well, and then general modalities are very, very important, aggravation, amelioration, and on this information we are going to construct the predominant active miasm, and for that active miasm we'll take into consideration and decide about the posology, selection of the remedy, selection of the potency, selection of the repetition on the basis of your overall assessment of susceptibility of the patient. And the medicine could be intercurrent miasmatic remedy, a constitutional remedy, acute, subacute, or second prescription. Everything is included here. So this is the format we are going to deal here with. But let's recapture certain informations which are not given in Allen's keynote. So that information is remedy profile. Medorrhinum is a deep acting and remedy for chronic ailments due to suppression of gonorrhea, or it is a remedy type which is nosode in its character, and source is gonorrheal discharge. Friends, the preparation is attenuation of the virus is prepared in water from which the higher potencies are prepared. Remedy was proved by Dr. Son, and the organ tissue affinity sphere of action of this particular drug is mind, nerve, meninges, blood, sexual organs, breast, nipple, skin, mucous membrane, and lips. Let us go to the classical information with bit of here and there additional information is given. So first title is the Constitution, Soma, and here we find distinctly Ellen tells us children, pale, rachitic, dwarfed, and stunted growth, especially similar to Beretacab, they are mentally dull and weak. Thermal sensitivity, it is very, very chilly. We have taken this information additionally from Kent repertory, and lack of vital heat in UC generalities, Kent of repertory, and both of these symptoms are given in second grade strength. For side affinity, it is ambilateral. From the psyche point of view, we have the temperament. He is anxious, nervous, extremely sensitive, starts at the least sound. This is PQR 8 from mind section in Allen's keynote. Let us go to the mind, will, understanding, emotion, and intellectual areas. Here we find weakness of memory, cannot remember names, words, or initial letters. He has to ask name of the most intimate friend. Even he forgets his own name. It is PQR1, Mental General Allen. Now we go to the again mental sphere where we find cannot spell correctly. Wonders how a well-known name is being spelled. And then he has constantly he loses the thread of conversation. So he talks, jumps from topic to topic, and this kind of a conversation we know in clinical medicine word salad. Great difficulty in stating her symptoms. They need to be targeted in giving certain areas where we are demanding information. He slips away from the regular case giving. So he has to be corrected ki you have to tell me this because and then doctor has to frame the questions to be repeated as the patient loses herself. Friends, he cannot speak without weeping. This is very, very weepy patient. He anticipates death, always anticipating, feels matters most sensitively before they occur and generally correctly. He has a premonition and he gets irritated at trifles, cross during the day, exhilarated at night, very impatient, peevish. And here, one more important thing time passes too slowly. Too slowly, similar remedy, alumina, argentum nitricum, cannabis indica. These are important remedies we have. And in general, he is in hurry. When doing anything in such a hurry, He gets fatigued. Many symptoms are worse when thinking of them. Pain returns as soon as he thinks about them. Similar symptom we get in oxalic acid. Friends, we deal with the dreams, and here he has got dreams 2 plus, frightful 2 plus, ghost specters, which are given in Kent repertory. And he desires alcohol, fruits, ice, salad, salt, sour, acids, sweets, and extreme thirst. All are in 2 plus in Kent repertory. Patient is having aversion for nothing as specific as such, and food aggravates nothing as such. So far, we have searched the Kent repertory. Friends, let us go to the causation now. In causation, we find diathesis, the first thing. For persons who are suffering from gout, rheumatism, neuralgia, and diseases of the spinal cord and its membrane, even organic lesions ending in paralysis. Not only functional but organic lesions are also there which can be traced to psychotic origin. And then we come to for females with chronic ovaritis, selphingitis, pelvic cellulitis, fibroids, cyst, and other morbid growths of the uterus and ovaries, especially if symptoms point to malignancy with or without psychotic origin. That is also very important here. Either you will get the family history or the past history of gonorrhea which is suppressed, or spontaneously there will be a mutation in a psoriatic patient for serous carcinoma or cancer with acute or chronic in development when the symptoms correspond and a history of psychosis can be traced again. Let us go to the diathesis once more. Medorrhinum bears the same relation to the deep-seated psychotic chronic affections of spinal sympathetic nervous system that psorinum does to the deep-seated affections of the skin and mucous membrane. So, psorinum is a psoric medicine, and the first primary presentation is on the skin. And here the primary presentation was the urethric discharge because there was gonorrhea, which was the primary presentation, which was suppressed. And then we have secondary symptoms of psychotic miasm where there is a spinal sympathetic nervous system affection takes place, paralysis takes place. So here though comparison is there, but action of psorinum is primary, and here it happens to be a secondary presentation of psychotic miasmatic dyscrasia. Now, exciting cause or stressors elements from our for the constitutional effects of maltreated and suppressed gonorrhea. So, past history of maltreatment or suppressed gonorrhea is there. Complaints from standing cold water or working in clay, like in calcarea, we find. And elements of teething children, spasms during dentition, no fever. With fever, hot head, and hot skin is belladonna. Hello, friends, we go to characteristic generals now. Characteristic physical general. Great heat and soreness with enlargement of the lymphatic glands all over the body. So it is a active inflammatory state. It is not a passive kind of a thing which we see in tuberculosis, tubercular lymphadenitis. And consumptive languor, here there is a fatigue and great general depression of vitality, what generally we see in tuberculosis. And there are pains. Type of pains, we have arthritic pain, rheumatic pain, and how they come up, sequelae of suppressed gonorrhea. And because similar remedy, Daphne odorata is there, clematis is there. There is constricting pain, seem to be tighten the whole body. All over the body we have the blood vessels, and the blood vessels when they constrict, they cause constricting pain, what we see in cactus. And then soreness all over as if bruised like in arnica and epitorium. So it can be skin and muscles where we have this soreness. So friends, we have again characteristic generals. There is a trembling all over. But please remember, it is a subjective trembling. It may not be visible to you. And why it happens? Because there is intense nervousness and profound exhaustion in the Medorrhinum subject. And there can be stage of collapse. In collapse, it is a shock. We know that shock is hypovolemic shock, neurogenic shock, septic shock, cardiogenic shock. So here he's, he is going to tell us about this collapse or shock. And in this shock, he wants to be fanned all the time like Carbo-Veg, and he craves the fresh air. Skin is cold yet throws off the covers like camphor and sickle. And cold, and he's bathed in cold perspiration. And such symptoms usually in those days were seen in cases of acute hypovolemic state, cholera. Lot of cases were there probably. Now let us go to the characteristic particulars. From characteristic particular we go to the head region. Intense burning pain in brain, which is worse in cerebellum, extend down to spine. And then head feels heavy as if drawn backwards. Sensation of tightness and contraction extends down the whole length of spine. And headache and diarrhea both together occur. Why they occur? From jarring. Exciting causes jarring of ears. Now let us go to the throat. And in throat we find sensation as if she had taken a severe cold with distressing aching in bones. It means there is a sinusitis, the frontal bone, the maxillary bone, the ethmoid part of deep-seated pain in the head because there is ethmoid sinus is also affected. Throat sore and swollen. There is a deglutition of either liquids or solid is impossible. So dysphagia. Maybe there is inflammation in terms of there is tonsillitis probably. And then we go to the throat constantly filled with thick gray or bloody mucus from posterior nares like hydrastis, and this particular symptom tells us that there is a post-nasal drip. So friends, let us go to the appetite, and here the patient has ravenous appetite immediately after eating like cinna, lycopodium, sorinum we get symptom, and there is a constant thirst. Patient even dreams of drinking. That is the state. Insatiate craving for liquor, which before she hated asaram, is a similar remedy where desire for alcohol is there, desire for salt is there, calcarea, natrum, sweets it there like sulfur for La, ice, acids, oranges, and green fruits. So bowels, let us go to the bowels or GIT. We find stools, tenacious, clay-like, sluggish, cannot stain from sensation of prolapse of rectum like alumina. There is a constriction and inertia of bowels with ball-like stools. What we see similar remedy could be lacosis. And then comes can only pass a stool by leaning very back, very painful, as if there was a lump on the posterior surface of the sphincter, so painful as to cause tears. So it is similar like fissure in ano. Some of the symptoms are like that. And there is sharp needle-like pain in rectum, oozing of moisture from anus, fetid odor of fish brine. This is a also important symptom here. Fish brine odor is psychotic stamp, you can say. It is a classic characteristic. We go to urinary organs and then we find severe pain, backache in the renal region. It is better by profuse urination like what we see in lycopodium. And then we have renal colic, intense pain in the uterus with ureters, with sensation of passage of calculus like we see in berberis, lyco, ossimum caninum, ossinum can, and craving for ice is characteristic. Concomitantly we have Nocturnal enuresis is also there. Passes enormous quantity of ammonical, high colored urine in bed every night, which is worse by overwork or overexertion, overplay, extreme of heat or cold, or when the best selected remedy fails with a precondition with a history of psychosis. And there is painful tenesmus of bladder and bowel with urination. So it can be a cystitis. And sexual organs. We have predominantly female symptoms. Male symptoms are almost negligible here. In Ellen's, what we see, the menses very profuse, dark, clotted, stains difficult to wash out like McCarb. We have metrorrhagia at climacteric, profuse for weeks, flow dark clotted, offensive in gushes, are moving with malignant diseases of uterus. Next is the intense menstrual colic. It is dysmenorrhea with drawing up of knees and terrible bearing down labor like pains. Must press feet against support as we see in labor. So there is the intense pruritus of labia and vagina, which is worse by thinking about it. Breast and nipples sore and sensitive to touch. Breast cold as ice to touch, especially the nipple. Rest of the body is warm. And then respiratory system, we tells asthma, choking caused by the weakness or spasm of epiglottis. Larynx is stopped so that no air could enter, only better by lying on face and protruding tongue. We have soreness of larynx as if it is ulcerated. And then dyspnea and sense of constriction. Can inhale with ease, but remember, but no power to exhale like Sembicus. So this is a classical symptom, expiratory dyspnea, classical symptom of bronchial asthma. If you have inspiratory dyspnea, it is cardiac dyspnea. So respiratory organ, we have the cough. Cough is dry, incessant, severe, painful, as if mucous membrane were torn from the larynx, and there is a deep hollow like coughing, as if we are coughing in a barrel. It is worse at night from sweat on lying down and better by lying on stomach. Sputa. It is albuminous and frothy, small green, bitter balls, viscid, difficult to raise, and then incipient consumption. It is subclinical state of or early state of tuberculosis, and it tells us severe pain in the middle lobes. Most probably middle lobe is present on the right side of the lung. Back and extremities, the biggest chapter in Kent repertory, as well as the much more bigger number of symptoms you will find in Medorrhinum. Back, pain in the back between the scapula, the whole length of the spine sore to touch, like what we see in Chinimum self. And then comes intense burning heat beginning in the nape of neck and extending down to spine with contractive stiffness, which is worse by stretching. And then rheumatism of top of shoulder and arm, pains extending to fingers, worse by motion. If it is a right sided, it is sanguinaria. If it is left sided, it is ferrum. Let us see again. In the back and extremities, we have lumbar vertebra painful and sensitive to touch. And there is a pain in sacrum, coccyx, and back of hips running around and down the limbs. So it is almost something like sciatica. Pain in leg from hip to knees only when walking, and heaviness of legs like lead. Walking is very difficult. Legs are so heavy, legs give way. And there is the lower limbs ache all the night, preventing sleep, intensely restless and fidgety legs and feet, what we see in Zincum also. There is a terrible suffering of legs and arms during an electrical storm. And next symptom comes aching in legs, with inability to keep them in still in bed, worse, when giving up control of himself, when relaxing and trying to sleep. So these symptoms go in favor of clinical diagnosis of restless leg syndrome, of fibromyalgia, similar to something, and sciatica also. Coldness of leg and feet, hands and forearm is uh, next symptom. Drawing, contracting, sensation of the hamstring and ankles, cramps in calves and soles like what we see in cuprum metallicum. Ankles easily turn when walking. We have similar symptom in carboanimalis and ledum. Burning of hands and feet wants them to be uncovered and fanned like what we'll encounter in cases of lechosis and sulfur. Almost entire loss of nervous force in legs and arms, exhausted by slightest effort. It is a semi-paralytic state, and initially if it is going to start with, so probably Guillain-Barré is the one of the burning examples we have to keep in mind. If it is sudden, you find weakness, ascending weakness. So it is a Medorrhinum is also a very good remedy here. There is a painful stiffness of every joint in the body. So every joint, small joint and big joints, most probably we are talking about something which is rheumatoid arthritis. Deformity of finger joints, large puffy knuckles, swelling and painful stiffness of ankles, great tenderness of heels and balls of heel, swelling of all joints are puffy like wind galls. So this particular total symptom tells us that there is a polyarthritis. That is inflammatory polyarthritis. There could be many conditions where you will find, but classical example could be the gout and painful heel and ball of feet. Here it could be similar like ledum, and it can be at times takes place with gout also. So compare, we have to compare this remedy. If we are comparing with Ipecac, we are comparing in terms of dry cough. And camphor, sickle car, tobacco, and uh, this remedy is in collapse. Veratrum album, we are going to deal in collapse, shock-like condition, hypovolemic shock we are talking about. The cramps, etc., they are because of loss of calcium, potassium, sodium, so minerals which we are lost, and dehydration causes this kind of a pain. So it needs to be replenished. The loss of minerals needs to be supplemented in ORS or something. Picric acid, gelsemium, inability to walk, it tells us about the weakness of lower extremity. And aloes and sulfur is specifically we have to differentiate in morning diarrhea. The burning feet of sulfur and restless fidgety leg and feet of zinc both are found at the same time in Medorrhinum. So mathematically all these symptoms, if you see causation and complaints, point to psychotic traits, and we infer from this information that Medorrhinum is a predominantly psychotic miasmatic remedy. So friends, the general modalities we will find aggravation when thinking about the complaint like helonias and oxalic acid, heat, covering, stretching, thunderstorm, worse by least movement, and sweets also aggravate. From daylight to sunset, it is reverse of syphilinum. Syphilinum is worse at night and psychosis is worse during the daytime. Amelioration you will find at the seashore, it is reverse of natremure. And then we find lying on a stomach and damp weather. We have amelioration of symptoms of Medorrhinum in damp weather, though it is covering most of the rheumatic complaints, and it is similar to causticum and nux vomica. Friends, let us go to the posology part. For doses, high single potency, one dose is recommended. Repetition is not recommended. Duration of action, we are not very sure about it. Clinical condition where you will find it useful is a very wide range rather. Amnesia for recent thing, dyslexia, word salad, VP, Anticipatory anxiety, we have dwarfism, mental and physical retardation, manic state, delusion of time sense, nervousness, gout, rheumatism, rheumatoid arthritis, fibromyalgia syndrome, malignancy of female genital tract, dysmenorrhea, metrorrhagia, ovaritis, selphingitis, pelvic cellulitis, fibroid uterus, ovarian cyst, malignancy of female genital tract. Again, I am repeating. Asthma and simple cough can be there. Epistaxis, bulimia, alcoholism, renal colic, nocturnal enuresis, and cystitis. These are the important areas we can recall so far. So, friends, thank you very much for watching and listening. Sharing is caring.